Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Coming up, answers to your holiday etiquette questions. But first tonight, the winter solstice. This is the shortest day of the year, and for some people, that lack of daylight can trigger the winter blues. Joining us to discuss seasonal affective disorder in this week's Your Health segment is Dr. Theodore Postolake, professor of psychiatry at the University of Maryland School of Medicine and psychiatrist with the University of Maryland Medical Center. Doctor, thank you for being with us.
My pleasure.
This is formally known not as the winter blues, but as seasonal affective disorder. What's the range there? Is it severe in some and a minor irritation in others?
Yes, so I think it's important to differentiate between its impact on functioning, work functioning, academic functioning, and it could be quite considerable for those individuals who have indeed a full-blown seasonal affective disorder. And then we also have minor forms. These may consist of feeling a little bit sleepy, feeling less energized, having an increased appetite, putting on weight, eating carbohydrates a little bit more. For instance, in my office, many times I have patients waiting and having candies in the office, in the waiting area, and so you can count the number of wraps people open.
You've studied this by season?
We haven't studied exactly the number of wraps, but we did study indeed appetite changes by season. And indeed there is quite a bit of an increase in body mass in patients with winter depression. Also we have an elevation in lipids, in glucose. So there is an elevation potentially in a cardiovascular risk overall. But then I think the main differentiation would be between what we would call holiday blues and then seasonal affective disorder, or maybe winter blues.
Well, maybe one way to separate that is to look at what happens to people in the southern hemisphere, where the longest days are at this time of year, so they would figure to experience these symptoms in July and August. Does that happen?
Excellent. It's exactly one model of studying epidemiologically the concordance versus the divergence between the southern and the northern hemisphere. But all in all, also people who tend to have holiday blues tend also to have similar symptoms at other times when either people at large celebrate festivals, religious festivals, for instance, or when there is an anniversary, let's say an anniversary of marriage, or maybe birthdays. So there is a tendency for certain individuals psychologically to react with sadness or even depression around those particular time points.
For people for whom it's more seasonal as opposed to holiday or anniversary related, some of it sounds normal in my experience. I always put on a few pounds in the winter, and I'm exercising less, and it's not that big a deal. It feels normal to me. When does this cross over into being something that's a serious issue?
So the way we speculate, the way we hypothesize about this is that these changes have been in fact adaptive at some time in the past during evolution in mammals and in human evolution. And indeed,
we used to hibernate, perhaps?
I don't think humans hibernate. I mean, primates and even apes, when brought in temperate conditions, they tend to have seasonal changes, but they do not really amount to a full hibernation. And yet, what happens is that many times there's a tendency to anticipate, not to react to only, but to anticipate winter energetic bottlenecks, the demands of low temperatures, the decreased availability of food, leads to a reduction in general activity, potentially sexual activity in many animals, and conserving energy for survival. And so under the current conditions, this may be, of course, less adaptive. And I would say that the line will be drawn if there is significant impact on functioning and on health.
Let me remind our viewers, if you have a question about the winter blues, seasonal affective disorder, you can give us a call. We'll have the number up on the screen. You could also tweet your questions. The Twitter address is @MPT News. So for patients for whom it is a problem, what remedies do you have had? I've heard of light boxes. Does that work?
Yes, light boxes do work, and I think we could separate the type of remedies that have controlled studies, randomized controlled studies to support their role. So light treatment developed in the 90s is definitely helpful. We also have pharmacological agents. Bupropion was FDA approved for the treatment of seasonal affective disorder, but there are some other medications that are being used. And more recently, cognitive behavioral therapy, in fact, manualized for seasonal affective disorder, has shown some very good results, both when compared to controls as well as when compared in parallel with light treatment.
Does a week in the islands at the beach for people who have the time and the resources to do that make a difference for somebody?
So
we should test that, and I'll volunteer. But
yes. It'll be a nice study. I'm quite sure many indeed people would volunteer for it. The context, the background that would support that idea is that although light treatment is effective, and each of these modalities is effective, none of them really makes people with seasonal affective disorder, full-blown seasonal affective disorder, feel as well after treatment than in the summer. So that leads to combination of treatments, but also leads to the concept that there is something potentially in the summer that may really be necessary for a more complete response. And there have been indeed certain attempts to look not as a randomized controlled trial, but indeed like travel to the south in the northern hemisphere has shown by self-report that has a potentially positive effect. There have been also attempts to look at smell factors. In fact, smells of summer, the fact that there is a deprivation or olfactory deprivation in the winter. Of course, there have been attempts to look at temperature and sauna, or maybe hot tea and all that. But we don't have definitive information about the efficacy of those.
Let's take a phone call here. Arlington, Virginia. This is Marilyn. Marilyn, thank you for the call. Go ahead.
So my question is that in the fall, late October and certainly into Christmas, that it takes me 3 times as much mental energy to get anything done. So it's affecting my mental processing, and I want to know if that's related to seasonal affective disorder.
Thank you for the phone call. Symptom?
Yes, so it looks like, from what I understand, is that everything that needs to be done is done, but with much more effort. And we have seen this also in students in DC, in a study we published, in fact, in the American Journal of Psychiatry, in college students during finals, where a situation in which students were sacrificing sleep duration in order to achieve the task necessary to prepare the exams. So how to differentiate it, however, there are many reasons that may contribute to such a symptom. Seasonal affective disorder may be one of them, but there may be some other conditions, medical conditions, for instance, that would have to be looked at before concluding that this is indeed seasonal affective disorder. So I'll give some examples. So it could be, let's say, a low thyroid function that may have, for some reason, a trigger in the fall. There are sometimes allergies that occur in late summer, beginning of fall, initially ragweed and then spores. Allergies themselves could lead to directly to a sense of fatigue. And so all these things would have to be taken into account and sorted out by a professional, a medical professional maybe.
Let's take another phone call. Anne Arundel County, this is David. David, thank you for calling. Go ahead.
How you doing? This is my fourth-time caller. I have a question, doctor. How do you separate the diagnosis and treatment of someone that has seasonal affective disorder from someone that has bipolar disorder from season, maybe in a 4 to 6 month span to season?
Great question, David.
It can happen at any time. It can happen in August, I mean, any season, the bipolar. But sometimes it happens, and mainly it happens in the colder months. How do you separate that as a doctor?
So first of all, I would say that in this field there are people, there are authors that consider seasonal affective disorder as being on the spectrum of bipolarity. So it's an excellent question. I really appreciate the question because it not only raises the issue of how we separate, but also how we integrate, and also if we treat it differently. So there is a consideration like this, a view that seasonality is linked with bipolarity. In fact, we completed a study in the old order Amish, published last year, and we found that it was a genetic overlap between certain genetic configurations for bipolar disorder and seasonal affective disorder. So there is a distinct overlap that we can found genetically. Now, in terms of the separation per se, I think from a treatment standpoint, it's very important to diagnose that indeed there have been some episodes of high energy. We differentiate bipolar disorder in bipolar 1 disorder, where there is a functional impairment between this kind of elevation in energy, mood, potentially irritability or elation, and bipolar 2 disorder, where there is no elevation, no impairment because of that. The implication is that once we have this bipolar 1 situation, where the elevation may lead to a decrease in functioning, we have to treat it differently. So we have to use, in addition to the means that I have already listed, we should use also mood stabilizers, medications that may create not only a floor for mood, but also a ceiling.
Doctor, let me get to another phone call from Anne Arundel County. This is George. George, thank you for the call. Go ahead.
Thank you. I'm interested in whether there have been any studies showing whether there's a difference between having the sunlight being absorbed with the eyes open and going through the optic nerve system into the brain versus a group that had sun exposure that was only on the skin with their eyes closed.
George, thank you very much. Good question. Does the light box work if your eyes are closed?
So historically, the very first the first studies with light treatment at the National Institutes of Health, Thomas Ware, Norman Rosenthal, they have in fact addressed exactly that question. And there are some very nice slides. They looked a little bit strange, in which people really had like boxes, like really kind of fitted over their head to cover skin or to cover eyes. And
what was
distinctly, the answer is that only through the eyes this did light help. Now, this being said, there has been a study in Science published very highly showing that, in fact, light to the back of the knee may have certain effects on the physiology that is involved in SAD, but then all subsequent studies were not able to replicate that particular finding. So it is considered more like an artifact. And of course, if we look at light in a broad way, like if we include the UV light, the UV radiation is increasing vitamin D synthesis in the skin. There have been studies showing that an adequate level of vitamin D is important to adequately control seasonal affective disorders. So if we think about light in a global way, not only the visible light, but also the UV light, then yes, it is possible that the light to the skin and then travel to the south and all that may be effective through UV light and vitamin D production.
Well, the good news is that since today is the shortest day of the year, tomorrow is going to be a little bit longer, and the day after that is a little bit longer, so the trend is good.
Yes, yes, definitely. This is, in fact, the basis for the cognitive behavioral therapy of SAD, is to kind of to promote also the, when there is depression, you always see the negative as being very big, the positive very small, and so being able to dilate the positive, just like you said, is therapeutic in itself. I already feel better just by
Spring is
hearing
around, well, it's the television lights help with that.
Yes, indeed. These lights could indeed do quite a bit for...
Dr. Theodore Postolake, University of Maryland, thank you for coming by.
Thank you very much.
Do appreciate it. Just ahead tonight, minding our holiday manners. Please, we'll be right back.
Did U.S. decisions about Syria ignite a bigger threat?
It's all in motion, and at the last minute, the president blinked.
The more ardent jihadists are really calling the shots.
President Obama finds himself exactly where he didn't want to be.
Tuesday night at 10 on MPT.
Don't miss your chance to see folk legends the Kingston Trio, the new Christie Minstrels, and Barry McGuire live on stage at the Meyerhoff Symphony Hall on April 30th. Visit mpt.org/donate or call 1-800-222-1292 today.
Next time on Antiques Roadshow, tune in for even more amazing treasures from our 16th season.
Isn't that cool?
I never knew that.
Who? Really?
Seriously.
Oh my goodness. Oh my stars. Well, that was a good find.
Don't miss these fabulous finds and more from our extra special episode, Antiques Roadshow, Junk in the Trunk 2.
Tonight at 8 on MPT. Next time on Father Brown.
Sylvia Swan, 23.
What are they doing all the way out here?
A woman is murdered at a stone circle.
You do know the legend?
It's the most powerful time of the year.
Father Brown investigates during a village panic.
This is polio we're dealing with.
But to solve this mystery,
I will get to the bottom of it.
He'll have to risk his life.
Campbellford Police Station, please.
Father Brown. Tonight at 10 on MPT.
Joining us now in the studio is Joyce Mkende, owner of, is a certified etiquette expert. And I should start, Joyce, by apologizing, since you're good at etiquette, for mixing up the intro.
Oh, no worries.
Well, thank you for being here. I do appreciate
Thank you for having
it.
me.
So this time of year is a great time of year. People getting together, there are parties, a lot of social stuff that frankly makes some people nervous about doing the right thing at all times. How do you see that?
Well, yes, and I do get a lot of questions about protocol and etiquette, and maybe I should start by educating everybody what's the difference between protocol and etiquette. Well, protocol is a widely accepted principle in government, military, institutions.
You have a protocol expert on
Yes, you have a protocol expert, and it doesn't change over time. It remains the same. Whereas etiquette changes over time, and it's basically accepted behavior within a social group.
This time of year,
Yes.
I mean, there's some variations. It depends
there is.
who you're dealing with, where your family's from, and maybe you're involved with people from different countries who do things completely differently.
Absolutely, and we have to be respectful and aware of all the different cultures so that we do not disrespect anybody's culture.
So when one becomes a certified etiquette expert, what does one do with that?
Well, there's different routes. You could work for a company, you can teach, you can go within the government or the private sector. It just depends what route you want to take.
So what do you do in the holiday season as an etiquette expert and protocol expert that the rest of us uneducated folks don't do or we do wrong?
Well, gift giving. Let's talk about gift giving. It's very tricky when you have to give outside of your immediate family member. So you have to really pay attention to their customs and traditions and not insult anybody, again, like I said. And if you're invited out to an event or to somebody's home, you should ask politely if children can come, and also be mindful of what gifts you have to bring, because it's polite to bring the hostess a gift. And it used to be a bottle of wine or a nice bottle of alcohol will do well, but you have to be mindful of the different religions and not be disrespectful to that. And not everybody drinks.
Right. Okay,
so we have
so
to
the bottle of wine
that.
is the standby.
It's the standby, and it's a culture in America and in Europe. But if you go outside of Europe and America, then it might change. For example, if you go to a Muslim country, you obviously cannot bring them alcohol. Exactly. Right. And you cannot bring a nice set of knives either, because they take offense to that. It's a negative connotation for them. So you could bring something like an ornament, you can bring a nice crystal glassware or something.
What are the resources for somebody to figure this out if they don't have access to a certified etiquette expert?
Well, these days we have Google.
I've heard of
and
it.
Google seems to have all the answers. But yes, there are schools that are out there that you can contact, or you can look for one of us and contact us via the phone, and we'll be willing to answer.
Let me remind our viewers, if you have a question about holiday etiquette, you can give us a call. We will have the number on the screen, or tweet your questions. Twitter address is @MPT News. Now, when it comes to holiday get-togethers, making small talk with people you don't know can be intimidating for some. What do you recommend?
I would highly suggest you stay away from controversial issues. And the biggest
politics and religion
are out. So most times sports is huge. So a lot of people like to talk about football if it's football season. If it's basketball, talk about basketball. It's just stay away from controversial issues.
Let's grab a quick phone call. Caroline County, this is John. John, thank you for the call. Go ahead.
Well, I've always been confused about introductions. Who gets introduced to whom? By age, your boss? Would your guest please talk about a couple of different social situations where different kinds of people meet and somebody has to be introduced for the first time?
Wow, John, great question. Now for me, if I remember the names of both people, it's a win. I didn't know there was a distinction about who or whom gets pointed to first.
Right. Well, in business etiquette, it's based on hierarchy, and it's the order of precedence. So if it's the CEO of a company and they have a guest, if the guest is coming to the CEO, then the guest is introduced first. And in social etiquette, it goes by gender, age, and social standing. So if the person is So if I'm introducing a younger, say, lady, and the gentleman is older or whoever, I would say, Mr. John Doe, this is my daughter, and introduce them that way. But if it's somebody in a hierarchy than you, then they're introduced first.
Let me make sure I get this right.
Usually the person being introduced is, the person being introduced to is called first. So I'll say, if you were Mr. John Doe, I will say, Mr. John Doe, I would like to introduce to you Miss or Mr. Jane or John Doe.
And the big shot went first there.
Yes.
Got it.
Unless he's the host.
Oh.
Well, there are all these different nuances. And you want to be careful about your handshake and look at each party when you're introducing. So you look at the first person you named and the second person you named. So there are all these different nuances.
I'm going to stand there. If I have to go, I'm going to stand against the wall.
And if you forget the person's name and you remember the first name, then you can address them by the first name. And perhaps you can say, well, you know,
but now I have to interrupt because we're out of time. So I apologize. Joyce, thanks for being with us. Thank you for watching and have a good night.
Thank you.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.